Good morning. I'm here today to provide an update on the results of the COVID-19 testing of patients and staff at the Queen Elizabeth Hospital. And I'm pleased to say that there are no new cases of COVID-19 to report today. We continue to have 9 active cases of COVID-19 and a total of 36 cases in PEI since the onset of the pandemic. These 9 cases include the 2 cases that appear to be connected to the QEH, a healthcare worker and a patient who had contact in the emergency department on Saturday, July the 4th. And these cases were announced on Monday, July 13th, and patients, staff, and personal contacts of these cases have been tested. Efforts have been made to contact all patients that had contact with a healthcare worker, and there were 101 in total. 76 patients have been tested, and 16 have appointments to be tested today. 6 patients are out of province and are being followed up, and we are trying to reach 3 individuals who still need to be contacted. In some cases, messages were left, and calls have yet to be returned. And we are working on these 3 outstanding individuals that we have not spoken to. Approximately 500 staff have been tested. Out of an abundance of caution, more staff than originally reported were tested, and all tests are negative to date. The second round of testing for those who need to be tested will be started on July the 18th. And that includes 61 of the patients who need to have a second round of testing. Patients and staff who need to be retested will be contacted to arrange for the testing. Any member of the public that needs to self-isolate or work isolate as a result of being a contact of these cases has been contacted by Public Health Nursing, or the Queen Elizabeth Hospital will be contacting the staff to make sure they are work isolating. The QEH lab has processed 1,321 tests in the past 3 days, which is a very large number. 730 tests were processed yesterday alone. And I'd like to thank the staff at the QEH for their response to this situation, and a special thanks to the staff at the testing clinics and the QEH laboratory. It is a relief to know that all these tests have come back negative. And the second round of testing for those who need it will be completed by July 18th, 19th, and we'll be able to update you at that time. Islanders can be assured that the QEH continues to be fully operational and safe. As was mentioned yesterday, Islanders can be confident in the quality of care available at the QEH and all hospitals across the province. So please attend any appointments that you may have there, or if you have urgent medical need, please go to the emergency department. I do want to clarify information about essential workers who are coming to PEI to provide essential service. There are really 3 streams of essential workers. Essential workers coming to PEI to work in healthcare, essential workers manufacturing, aerospace, construction, and bioscience who travel to PEI to provide essential services, and a final stream of essential workers who are islanders who travel off island frequently to work and then return home. Essential healthcare workers who travel to PEI. These individuals have a negative test prior to reporting to work and will be tested again at day 3 and day 7. They are required to work isolate for 14 days and monitor for COVID-19 symptoms. Other essential workers who come to our province are required to work isolate for 14 days and monitor for symptoms. These individuals are not tested unless they develop symptoms. And the final group of essential workers are PEI residents who frequently leave the province for work and return home. And these individuals are required to self-isolate until they have at least 1 negative test. And following the first negative test, they are tested weekly and monitor for symptoms. And since the pandemic began, there have been thousands of essential workers coming to our province to provide services in many sectors. We rely on these workers to maintain essential health and other services. I know that there have been some concerns about visitation in long-term care and the desire of residents and families to have more contact. And I absolutely understand these concerns. We've moved first to outdoor visits and then to indoor visits in long-term care. Families can take loved ones in community care for recreational drives. But we know that COVID-19 has had a devastating impact on long-term care facilities and community residential facilities across Canada. Over 80% of COVID-19 deaths have been in long-term care, despite representing approximately 20% of the overall cases. So it is a delicate balance to ensure we are taking reasonable steps to protect the health and safety of residents and staff in residential facilities with the need for more social and physical contact with families and loved ones. So our office is working with long-term care sector to examine how we can ease the restrictions on in long-term care facilities and increase contact, but to do so in a really safe way. It is difficult to know how long this COVID-19 pandemic will continue. And it's difficult, too, to come to grips with what this means in terms of how long it will be. But this morning I was reflecting on how grateful I am to live here in PEI. We are all fortunate to live in a beautiful province with wonderful, kind, caring people. And my family and I could not imagine living anywhere else than this place. I encourage Islanders to take time to enjoy and explore our province and to do it safely. We have a resilient and strong healthcare system. Our system has been challenged over the past 2 weeks and has responded well. We have done everything and more than we needed to respond to the threat of COVID-19 at the QEH, and thank you for all those involved. In closing, please continue to do what Islanders do so well. Please be patient, kind, caring, and compassionate to yourself and others. Thank you. And I'll open it up for questions.
Tom Bateman, Times and Transcript.
Oh, good morning. I'm interested in PEI's position on a potential decision by the New Brunswick government to open up or to loosen border restrictions for some Quebec residents near our border. I wonder if PEI was consulted on that decision and how, and how it might affect the relationship between our two provinces. Thank you.
Hello. So I'm aware that these are small, really community bubbles between communities in part of New Brunswick and Quebec that are right on the border. So I'm aware as of last evening that was going to happen. And I think like many of the decisions around borders, it's a combined decision around health and the importance of the flow of people and product in these places. So I think I wasn't involved in any of that decision making, but I am aware of it. I think we continue to have self-declaration forms here in PEI before you arrive or as you arrive that need to be filled out. We continue to ask screening questions, so we will continue to do that regardless of this most recent decision.
Do I get a follow-up? Sorry.
Go ahead.
I'm just wondering, more generally, as our provinces become more integrated, and there's more implications if one of our provinces have these outbreaks, how you think we should maybe synchronize or coordinate the various restrictions and policies around entry into the provinces and that sort of thing. Should we be closer aligned on decisions like this?
Well, I actually think there's lot of interaction and communication between, I know, the Atlantic premiers as well as my Atlantic counterparts in Nova Scotia, New Brunswick, and Newfoundland and Labrador. So I think there's good communication there. I think we all are looking at the outbreaks, epidemiology in our different provinces and what's going on in the rest of the country. We're all, I know, looking at what has just happened with the restrictions with the U.S. border. So I know all those things are being looked at very collectively, and it was just a couple of weeks ago around the decision to all move towards an Atlantic bubble on the same day. And so I think there's been some good communication already, and I imagine that will continue.
Thank you very much.
You're welcome.
Karine Fleury, La Voix acadienne.
Oui, bonjour, Dr. Morrison. Mon question était, est-ce que vous pouvez répéter en français l'information que vous avez donnée concernant les travailleurs essentiels?
Je m'excuse, bonjour, j'ai pas juste entendu la dernière partie de votre question.
Oui, j'ai demandé si vous pouvez répéter l'information concernant les travailleurs essentiels.
OK. Je vais essayer. On a des travailleurs essentiels qui arrivent à l'île du Prince-Édouard. Il y en a des types de travailleurs essentiels. Il y en a qui travaillent aux hôpitaux et dans le système de santé. Il y a aussi les travailleurs essentiels qui travaillent d'autres manières avec la construction, comme exemple. Et puis aussi les travailleurs essentiels qui sont les insulaires et qui voyagent fréquemment de l'île du Prince-Édouard ailleurs. Et puis, pour les travailleurs essentiels qui travaillent en santé, le système santé, quand ils sont hors de la boule atlantique, ils vont être testés vraiment 3 fois maintenant. Dans la première semaine de travail, ils doivent être testés 1 fois négative, et puis ils vont aussi être faire du travail, faire tester 3e jour et 7e jour. Mais pendant ce temps, ils doivent isoler quand ils ne sont pas au travail. Les travailleurs essentiels qui voyagent souvent de l'île du Prince-Édouard, ils doivent isolés jusqu'à qu'ils reçoivent le premier test négatif, et après ça, ils vont être testés chaque semaine. Les autres travailleurs essentiels, comme en construction, ils doivent isoler quand ils ne sont pas au travail, et puis faire attention s'ils ont des symptômes, ils vont être testés. Alors, c'est beaucoup d'informations. Je m'excuse à propos de ces travailleurs essentiels, mais c'est important de les distinguer un peu parce qu'on en parle beaucoup.
Stephanie Van Campen, CBC.
Good morning, Dr. Morrison. You said yesterday that 18% of visits to people in self-isolation were not satisfactory. How do you feel about that percentage? And is there anything being done to improve that?
Hi, Stephanie. I think 18%, if I remember correctly, 18% of those they were the COVID-19 inspections, I believe, were not satisfactory. So it's not those in self-isolation. It's COVID-19, and they are usually because they did not have an operational plan in place, or they may not have realized it had to be written down. And so I think that is being followed up certainly by a combination of our public health, environmental health officials, but also inspectors with workers' compensation, liquor control, et cetera. So I'm not sure is that maybe I misunderstood the question.
I have another follow-up on compliance. Can you tell us a little bit more about, in general, what the compliance level is for people who are self-isolating?
Okay, yeah. So in terms of self-isolation, as we mentioned yesterday, we have approximately 900 people in self-isolation. It, of course, changes every day as new people come on the list and some people finish their period of self-isolation. And I think overall there's been really very good compliance, but we have had some complaints about people not following the self-isolation, and we are following up on those as we reported yesterday. So overall, I think having our Operation Isolation contact people and remind them of why they need to self-isolate, make sure they have the supports which allow them to self-isolate, give them information and answer their questions about self-isolating, continue to be important. And in fact, some of that information about how we do it has actually been shared with a couple of other provinces who were interested in how we were able to do it.
So those calls are still happening daily to people who are in isolation?
Yes. So and these are people who come in with pre-approval travel from outside the Atlantic bubble. They may be here for a variety of reasons, and they get put in, they are identified and put into a system, and we call them as part of the Operation Isolation, and we've been doing that now for a number of months. We have over 6,000 people who've successfully completed their period of self-isolation where they did receive calls for that 14-day period. This is in addition to the calls that are made on a daily basis to any cases or close household contacts of cases of COVID-19.
Thank you.
You're welcome.
Julien Lecacheur, Radio-Canada.
Bonjour, Dr Morrison. Lundi, vous nous disiez 24 à 48 heures déterminantes. Nous sommes 48 heures après lundi et pas de nouveaux cas, un hier, mais aujourd'hui aucun, et surtout aucun lien avec ce travailleur essentiel de l'hôpital Queen-Elizabeth de dimanche. À quel point aujourd'hui vous êtes vraiment soulagé, encore plus qu'hier, d'être passé, d'avoir réussi à éviter le pire à l'île du Prince-Édouard?
Je suis un peu plus soulagée aujourd'hui qu'hier après tout ce grand nombre de tests négatifs. Mais comme avant, il faut qu'on reçoive un deuxième test pour un certain nombre de personnes. Alors, c'est peut-être le 19 ou même le 20 que je peux être plus en confiance qu'on a mis nos bras autour de ces deux cas.
Un follow-up, Dr Morrison. Après ce qui s'est passé à l'hôpital Queen-Elizabeth avec ce cas, ce travailleur essentiel, est-ce que vous avez changé les règles pour les travailleurs qui travaillent à l'hôpital Queen-Elizabeth? Quand je parle des médecins, des infirmiers, infirmières, est-ce qu'ils ont plus de moyens, plus de masques, plus de règles à suivre? Est-ce que quelque chose a changé depuis ce cas découvert?
Alors, même avant ces deux cas, l'instruction était de mettre, pour les travailleurs comme médecins, infirmières, de mettre les masques quand ils prennent soin des personnes à l'hôpital. Quand ils ont des interactions clinicales, ils doivent mettre un masque. Et pour ce bout de temps, avant que tous les tests, les deuxièmes tests soient complets, on va aussi augmenter, c'est pas seulement masque, mais des autres parties de l'équipement protectif. Alors, c'est et je pense que c'est une bonne occasion pour tous les travailleurs à l'hôpital et partout d'en penser. On connaît l'importance de l'infection, prévention et contrôle. Et puis, on va faire attention encore dans les prochains jours.
Merci beaucoup.
Okay, merci.
Carrie Campbell, CBC.
Good afternoon, Dr. Morrison, I think we're into now. I just wonder, you mentioned we still have the 9 active cases. I wonder if you could just give us an update on the conditions of those. We're kind of wondering if, some of the younger people who contracted this, if they have possibly recovered primarily by now, and also whether we've had anyone who required hospitalization or any assistance at all. Wondering more about that, the woman in her 80s and how she's doing.
Hi, Carrie. So, in terms of the group of the cluster of 20-year-olds, there are a couple of those cases who should be out of that period of self-isolation in the next day or two. So I'm hopeful we'll be able to give you that final number. Basically, they can come out of self-isolation if they're finished that period of time and don't have any symptoms. So I think we're hopeful in the next couple of days to be able to give you that recovered number, and I think that's going to make us all feel a little bit better too. And one of the other cases, there have been no admissions to hospital. That certainly and we do check on a daily basis. I think the case that is a female in her 80s, we know that people who are older, higher risk and have more symptoms at times, and so we have been probably more concerned based on her symptoms, but certainly she was at home yesterday.
Okay, thank you for that. I wonder further to something we heard from you earlier this week as well, when you said that this is not the time to expand the bubble to make it sort of a Canadian bubble. We now see New Brunswick looking to include part of Quebec. I don't know where Nova Scotia's at these days, but the last that I recall hearing from them, they were looking to expand their bubble to include the rest of Canada. I just wonder what you think it means for trying to keep COVID out of PEI and our Atlantic bubble, what it means if some of the other provinces start opening up, and if you would be comfortable with the existing Atlantic bubble if the other provinces start doing that.
I think that's a good question, Carrie. I think certainly with the last 2 weeks, with the situation at Whisperwood Villa, what has just happened in our healthcare facility, it has highlighted the impact on our system with even a small number of cases. And so from my perspective, when we look at decisions around our borders and our Atlantic bubble, Canadian bubble, we have to look at not only the risk of importation of, and we're doing a lot of good things to try to screen people and have them fill out self-declaration forms, but we also have to pay attention to our capacity in our healthcare system to respond to what's going on here, plus additional people. So those are the things that, and issues around the cases, the numbers, and the impact to the system are the things that I'll be discussing certainly with our Premier, and I know he's having conversations with his colleagues in Atlantic Canada.
Thank you.
You're welcome.
Stu Neepy, The Guardian.
Hi, good afternoon, Dr. Morrison.
Hi, Stu.
I wondered if you could clarify a little bit of the large number of people who've been tested over the last day or so, particularly linked to the 2 most recent cases, including the healthcare worker and the woman in her 80s. What's the protocol for people who might have a second test? Like, how do you figure out who gets a second test aside from the sort of first initial test if it's negative?
Hi, Stu. So I think what's really important, and we're in conversation with the Queen Elizabeth Hospital about what is considered more a close contact. So if you had face-to-face contact for more than 5 minutes without a mask on, or one person didn't have a mask on, that would be considered a more close contact with the healthcare worker or with the patient. And now the patients have all been identified, but in terms of the staff, that would be one way to look at who should need a second test. And that second test would happen similar to all the patients, a minimum of 7 to 8 days after the exposure. So if, for instance, if there was a close contact with the healthcare worker on July 4th or 5th, and you were tested yesterday, you would only need one test. But if you had close contact with the healthcare worker on July the 10th, you would be tested again on the 17th or 18th. So that is the part that is being worked on with the Queen Elizabeth Hospital. And because if you need to have a second test, it's we don't want to miss anybody. And just like the patients, there'll be a portion of those close contacts that may need a second test. It's certainly reassuring, as we said earlier, that so many tests have been done that have been negative, but it really won't be until the 18th and 19th when we get those second round of tests back from both patients and staff that we will feel more reassured.
Okay, and I do have another follow-up, but I was wondering if you do have kind of numbers on how many people, both patients and staff, needed a second test.
So 61 patients out of the 101 will need a second test. And in terms of staff, they're going through that process, and we'll be identifying those staff. And I hope to have those that confirmed later today, so that that second test can be arranged. The additional staff were tested, as I mentioned, and I think it's important for the facility, for the staff, to make sure that there were additional staff tested, so I think the larger number than had really close contact, but they still were tested, and I think that's important for everyone to know.
Okay, and I guess just a question about the long-term care residents. There was a little, there was the picket at the legislature yesterday. Some family members are suggesting that there almost be a category of close family members of long-term care residents who be given expanded visiting rights, I guess, which, they argued would include closer contact, the ability to have hugs, possibly even longer visit times than the 60 minutes. So I'm wondering what you think of that, of having sort of like a smaller group of so-called essential visitors from like close family within long-term care facilities.
So I think that's sort of what I referenced there in my notes, that our office certainly, there's a group looking at working with long-term care, both private and public, to consider those options of that stepwise approach, but trying to balance that, being very careful because it's not just one person but if you introduce COVID-19 into a long-term care facility by anyone, the risk of it spreading and having a tremendous impact and devastating impact to the facility. So I think the discussion is certainly underway. It's been underway as we went from outdoor visits, indoor visits, et cetera, going forward. So I think it's an important discussion to have. We recognize how critical the connection is with our families and our loved ones, and the interaction, and how we can do so safely is important discussion to be had by everybody.
Okay, thank you very much.
You're welcome, Stu. Thank you very much.